Good afternoon, everyone. Welcome to our September State Advisory Council meeting. My name is Dr. Morgan Crossman, and I'm the Executive Director of Building Bright Futures, and I'm really excited to have you all here today. It's such an incredible meeting for us because we're coming to it with so much respect for this network and deep gratitude for the development of Vermont's Early Childhood Strategic Plan. This plan that we're going to talk about today represents our collective vision, our values, and the priorities for kids and families prenatal to age 8 for the next 5 years. It's such a pleasure that we have Dr. Nadia DuBose with us from Creative Discourse. So many of you have been involved in the process to update this strategic plan, and we're so grateful for Creative Discourse's work to help us build strong partner engagement and really build the next iteration of this plan. One of the things that I think is really critical to name as part of this work is how now more important than ever is putting some of this work in writing, given our national political climate, where debates around kids and families and the importance of our system of services stand, given the role that government plays in early childhood and where there's going to be lasting effects. Vermont's been such a leader for kids and families in the country, and I really feel strongly that this current plan is our collective commitment to prevention, equity, shared accountability, and names what needs to be in place over the next 5 years. As you're looking at the next iteration of the strategic plan, we did introduce those most recent 5 goals. You're going to hear more about the plan's design and the process that we use to develop it if you weren't as involved. And then a little bit about our commitment to equity and justice and why some of these key priorities landed in the strategic plan in the way that they did. After you hear from Dr. DuBose, I will talk a little bit about our approach to how we're going to monitor and hold the system accountable, but also what it means for you who are SAC members to actually endorse the plan on behalf of the system. And then after we move through that presentation portion, we're going to spend some time in groups of 3 and then a large group, really talking through what this plan is, what you're excited about, share any areas of tension or concern. And then we're going to provide each of our State Advisory Council members 2 minutes to share. So really looking forward to hearing your thoughts, what you're excited about, and what you want to name for the broader group. So if you're an SAC member, please be ready to do that in a little bit later in the meeting. In terms of housekeeping for today, those of you who are joining us via Zoom, we would like you to make that introduction in the chat bar. And for our State Advisory Council members, at least for the business portion, if you can have your cameras on or make a note for Flora and Elisa. All right, I'm going to turn it over to Elisa to do our roll call this afternoon.
Hi, everyone. For those of you who don't know me, I'm Elisa Stallberg. I'm the Director for Family and Child Health at the Vermont Department of Health, and I serve as the public co-chair of the SAC. And we're going to start today with our public member roll call, and someone might be posting that in the chat, perhaps, so you know when you're coming. Janet McLaughlin.
Hi there, Janet McLaughlin, Deputy Commissioner, Child Development Division within the Department for Children and Families.
Thanks, Janet. Laurel Omland.
Hi, Laurel Omland, Director of the Child, Adolescent, and Family Unit at the Department of Mental Health.
Tammy Bates.
Hi, everyone. Tammy Bates from the Agency of Education. I am the Early Education Program Manager.
Susanna Davis. Okay. Renee Kelly.
Good afternoon, everyone. Renee Kelly, Vermont Head Start Collaboration Office.
Susan Coburn. I think she said she was out today. Jessica Vintner. Lindsay Barron. Lindsay's on vacation. And now to our legislative representatives. Representative Garofano.
Yes, Representative Garofano, Chittenden 23, Vice Chair of Human Services.
Thank you. And Senator Gulick? Not present, it says. Excellent. And then moving to our private members, my co-chair, Floor.
Hi, everybody. Flor Diaz-Smith with Vermont School Boards Association.
Thanks, Floor. Sharon Harrington.
Good afternoon, Sharon Harrington, Vermont Association for the Education of Young Children.
Mike McRae.
Hi, folks. Mike McGrath. I'm in for the Vermont Principals Association today.
Kiona Heath.
Hi, everyone. Kiona Heath with the Vermont Network Against Domestic and Sexual Violence.
Becca Webb.
Hey, everybody. I'm a UPK coordinator and special educator.
Christy Swenson.
Hello, everyone. I'm Christy Swenson from the Vermont Head Start Association.
Danielle Mitchell. Carol Langodden.
Good afternoon, everyone. Carol Langodden. I'm here representing the Vermont Parent-Child Center Network.
Dr. Deb Hartswick.
Hi, Deborah Hartswick, retired pediatrician representing medical personnel on the State Advisory Council.
Thank you. Eddie Gale.
Hi, Eddie Gale, and I work with the A.D. Henderson Foundation. I live in Johnson.
Dimitri Gardner.
Hey, everybody. Dimitri Gardner. I'm the business rep on the State Advisory Council. Good to see everybody.
Laura Young.
Hello, everyone. Laura Young, parent representative in Caledonia County. Thank you.
Amber Houston.
Hi, everyone. I'm also a parent representative, and just to note that I will have to step out at 2:30 today.
Thanks, Amber. And also noting that Monica Hutt, who's representing the governor's office as a non-voting member, is sending her regrets today. And I think we're good. So I'm going to pass it over to you, Flor.
Thank you, Lisa. Now I'm looking for a motion to accept our minutes of July 28, 2025. Could somebody make that motion, please? Ray
Garofano.
Okay. A second, please.
I can second. It's Carol.
Thank you, Carol. All those in favor, please. Well, any discussion? Do you guys have a chance to read the minutes? Okay, seeing none. All those in favor, please signify by saying aye.
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 Right. Any opposed? Any abstentions? Hearing none, the minutes have passed. Thank you, everybody. And I'm going to give it back to you guys.
Thanks.
Again.
Sure. So we are a couple minutes early, which is amazing because we have so much to talk about with the Early Childhood Strategic Plan. So I'm really excited to welcome Dr. DuBose, who is going to talk a little bit about the work that Creative Discourse pursued over the last year and a half to help support this project. You're still on mute, Nadia.
Oh my gosh, mutes. Thank you, Morgan. And thank you to every one of you here who has been part of shaping this strategic plan. Before I get into the details of the plan, I just want to take a moment to acknowledge how much it's really meant to me and to our team at the Creative Discourse Group to be a part of this work. I've had the privilege of working alongside my colleagues, Dr. Reese Kelly, Dr. Molly Loomis, and my co-founder and principal, Susan McCormick. And each of them has contributed incredible thought, rigor, and care to this process. And together we've carried the responsibility and the privilege of listening deeply to Vermont's families and ensuring their perspectives are not only heard, but honored in this plan. And I can speak for our team collectively and share that the most meaningful moments have been sitting in rooms directly with families. One example that stays with me was a gathering with a community of African women where we shared stories with interpretation in Swahili. And we began by sharing food together, prepared by one of the women while the children played around us. In that setting, grounded in culture and in language and in daily life reminded me that these conversations are not abstract policy discussions. They're personal, intimate, and sacred opportunities to listen. And that experience and so many others like it have been invaluable in shaping the heart of this plan. And so what we're sharing today is not just a policy document, it's a roadmap built from the voices of Vermont families and early childhood professionals, paired with the best evidence and planning data from across our state. And it's unapologetically rooted in equity and justice. This plan is grounded in listening. Over the past year, nearly 200 Vermonters shared their lived experiences. Parents, grandparents, kinship providers, educators, childhood providers, and community leaders. We heard stories from playgroups and schools, at family shelters, and from incarcerated fathers. We read handwritten letters, we sat in facilitated conversations, and we fostered an exchange where a state leader spent a day in the life of a child care provider and vice versa. We use this multifaceted approach: conversations, letters, immersive exchanges, surveys, and data review. And we paired what families told us with insights from statewide planning and monitoring to make sure the priorities in this plan are grounded both in lived experiences and in other evidence about what our system needs. And what we heard was consistent and powerful. Families told us what works: community programs, free meals, early intervention, trusted relationships with teachers and health providers. And families told us what's breaking them: financial stress, housing instability, unaffordable childcare, long waits for mental health care, transportation barriers, and discrimination that's still deeply embedded in our systems. And families told us clearly they do not want handouts. They want respect, they want systems that are responsive and inclusive, and they want real reciprocity, systems that give back in proportion to all that families already contribute. This plan makes equity and justice non-negotiable. That means we didn't just tuck equity in an appendix or a one-page statement. We built it into the guiding principles and goals themselves. For example, Goal 1, meeting families' basic needs, doesn't only talk about food and housing in abstract terms. It calls for paid family leave that covers all workers, for housing models that reverse exclusion of first-generation and BIPOC buyers, for legal aid partnerships so families can challenge discriminatory denials. Goal 2, safe, healthy, and healing environments, names abolishing discriminatory and carceral policies that criminalize Black, Indigenous, disabled, and immigrant families, calls for BIPOC-led crisis response teams, and community-centered safety alternatives. This is equity not as a value statement, but as a set of concrete, measurable commitments. Families told us we don't want to just be asked our opinions. We want to see what happens with what we share, and this plan takes that seriously. Goal 5 is all about shifting power. It doesn't treat family voice as a hypothetical nice to have. It embeds requirements for compensation, training, support for family leaders on state bodies. It proposes metrics to track whether families are actually influencing decisions, not just attending meetings. It even calls for a formal legislative protocol so that whenever a new state commission is created, impacted families must have a seat and the supports to participate fully. That's reciprocity. When families give us their time, their wisdom, their stories, we are accountable to giving power back, resources, and change. And there are examples throughout the plan that bring this to life more. Under Goal 1, strategies call for engaging kinship caregivers in designing supports and ensuring benefits that treat kinship care on par with foster care. Under Goal 3, strategies require us to fund restorative practices in early childhood settings and publicly report discipline data by race and disability because families demand accountability for how their children are treated in classrooms. Under Goal 4, the workforce goal, we call for equity-centered recruitment into early childhood careers, including scholarships and streamlined licensing for BIPOC and immigrant professionals because families told us they want their children taught and cared for by people who reflect and affirm their identities. And under Goal 5, we built compensation, training, and accessibility for family leaders. So participation is not just symbolic. Each of these is a tangible example of how family participation is embedded in this plan, not theoretically, but part of how Vermont's early childhood system must operate going forward. And all of this is anchored by 6 guiding principles: Families and caregivers are leaders and central to decision-making. Equity and justice are non-negotiable. Brain and developmental science guide our work. We build on community strengths and resilience. Bold, achievable goals drive collective action. Accountability, transparency, and continuous improvement are essential. And these principles aren't abstract. They show up in how strategies were written throughout the plan, in the instance that goals be measurable, and in the plan for annual reflection cycles where families are not just consulted, but serve as co-leaders in evaluating progress. Together, the 5 goals move us toward a vision where by 2030, Vermont families have stable housing, nutritious food, income, and transportation. Vermont children grow up in safe, healthy, and nurturing environments. Every Vermont child has access to inclusive, high-quality opportunities to learn and develop. Vermont children are cared for by a well-supported and equitably compensated workforce, and the system itself is coordinated, family-centered, data-driven, and resourced to respond equitably to every community. And this vision is not just aspirational. It's grounded in the real needs and real strengths of families that they shared with us, and in the clear evidence of where inequities are most entrenched. So when we say this plan is unapologetically about equity and justice, we mean it. We mean that racism, ableism, poverty, criminalization, and discrimination have shaped our systems, and dismantling those inequities must shape our solutions. We mean that families are not only at the center of this plan, they're at the table as co-leaders and decision makers with accountability structures to make sure that it's not just talk. And we mean that this is not just BBF's plan. It's Vermont's plan. It's the system's plan. And it calls for shared ownership, shared stewardship, and shared accountability to make Vermont a place where every child and every family can thrive. Thank you, and I look forward to seeing how all of you in this space and beyond steward this plan forward.
Thank you, Nadia. So you just heard about the incredible work that went into this plan and where we are today in terms of, the second iteration of a 5-year strategic plan for kids and families that's based on so much work, decades of work, to say, here's what it means to hold children and families at the center. One of the things that I have the luxury of talking with you all about today is that it's not just a document anymore. The strategic plan used to be something that we would publish and it would live over here, and several of us would talk about it. But not everyone had and shared that collective vision for the strategic plan. And one of the things that I'm most proud of in this iteration is that over the last few months of feedback and discussion and debate, it's showing that the plan isn't just a document anymore. Folks are really looking to this document as the most important vision and strategy for what is in writing, and really holding ourselves accountable to the needs of kids and families, to holding ourselves accountable to doing what's best for the state, given the current political and financial climate. So the way I want all of us to be thinking about this iteration of the strategic plan is that it's a plan of plans. One of the most important pieces of feedback that we heard from so many of you was, it's too much. There's so much in here. How do we actually hold this? Recognizing that there's so much that we need to do across sectors. The reason for that is because we, as a state advisory council and early childhood leadership for the state, are responsible for kids and families across so many different sectors. We know that there are so many different conditions in a child's development in their environment that are impacting their development over their life course, right? Whether it's in the physical or mental health space or in their longer term outcomes. So when we look at this plan, even though it is a very large, comprehensive document, it's a plan of plans that says, here are the priorities across health, education, family support, community well-being, anything that touches and supports a child and their family in our system. And I'm really proud of that on behalf of this network. As Nadia said, I think the other thing that we as a network should be really proud of is that the plan's shaped by data. It's shaped by lived experience, and it's shaped by leaders and community members across every sector for kids and families. It is emphasizing all of the core values that we've held as a state for over a decade, with language that's aligning with the Vermont guiding principles. It's reflective of the most important timely priorities for kids and families across all sectors. And it's including priorities that we might not have traditionally held in this early childhood sector, like climate change and transportation. And those aren't coming just from our national experts, right? We're hearing from families and even sixth graders in the NEK that transportation is something that is really important and impacting them right now. One of the other pieces that I want to name for this group as you're looking at the current iteration of the strategic plan is that there's one section that we're calling still under construction, and we're going to be workshopping this with a range of State Advisory Council members over the next 3 weeks to land on final language. So the section, I believe it is 3C, really focused on K-3 early childhood education and outcomes within that space, is something that we're still working with leadership on across the state. If you have feedback, we are open and excited to talk with folks about it. I also want to talk a little bit about the plan and the sign-on process and how we're thinking about accountability. In addition to folks saying this thing is so comprehensive, what we heard is, how do we hold each other and ourselves accountable? How do we measure success? And where we've landed is that it is our collective responsibility to move forward with each piece of this strategic plan, but it's not a top-down approach, right? So this is not a Building Bright Futures plan. We are not going to be coming out and, really having a way that we are trying to control how this work goes forward. The role and the responsibility of this network and partners is to see yourselves in it and then hold each other accountable to the values. So State Advisory Council members, I'm speaking to you for a moment. You all get to have a formal vote to endorse the strategic plan, but it's not just your strategic plan, right? It's the states. And we, as the State Advisory Council, aren't the only ones that are responsible to moving it. When we call for a vote at our next month's meeting, what we're asking you as the SAC to endorse is the highest level vision, the goals, objectives, and strategies, and what we are working towards for the next 5 years. When I say endorsing strategies, I'm actually talking about bold strategies, and not in the this is bold change, actually bold writing in the strategic plan, right? So you'll be endorsing down through the bold strategies. And then I want you to be recognizing that everything under those are example actions, and those things are going to be more fluid. And that might be based on political context, our financial stability as a system, as a state, and other contextual factors. It also means, as a State Advisory Council, you might not have a formal role in every single section, but you're still committing yourselves, all of us as partners, to that partnership, the understanding and the collective action for this plan. In addition to the State Advisory Council, now I'm talking to everyone, right, including SAC members. What is stewardship and accountability when we look at this plan? Instead of naming you and essentially coming in and saying, here's who we think is responsible for different components of this plan, what we're going to be asking over the next month is for partners to be signing on to the strategic plan. What that means is that you're committing to your own actions in discrete areas of work and supporting and holding each other accountable in other areas. That action, that stewardship, is going to look different based on where you sit, what your role is. If you are a parent, if you're a legislator, if you're an agency leader, if you're an advocate, right? So there are 5 different ways that we're going to think about stewardship and accountability in the plan. The first is, and I want you to be thinking about which level or levels you and your organization represent. The first is showing demonstrated commitment. So is your organization continually investing time, resources, advocacy, policy power, staff time into a specific objective or strategy within the plan? Is your role to uphold fairness and inclusion and actively advancing support for every child and family across systems? Does your organization actually hold the capacity to influence or create change in policy, practice, or public awareness? Or do you share alignment where the goals and values of your organization are aligned with those in the objectives and strategies in the strategic plan? And lastly, there are some of you who are going to have formal responsibility for the strategic plan, meaning you have a statute or a formal mandate to carry out pieces of the work. So what we're going to be doing over this next month is sending out a request and asking you personally and organizationally, and to share with partners, where do you see yourselves within objectives and strategies, and signing on to say, yes, we are doing work in this area and we are committed to partnership in thinking about how to do this really well as a state. For our agency leaders, we are going to be working with all of you, in addition to the governor's office, to identify all of the different areas where agencies, departments, and divisions are responsible for different scopes. As we move into monitoring, right? So how do we know if we're making a difference in this thing? What we've learned from the last iteration of the strategic plan is it's not just about the numbers in the dashboard. And we love dashboards at BBF, so there still will be one. But we're not just talking about those numbers. We're talking about cycles of reflection, adaptability, accountability, and really thinking every single year, did we hold true to the values of inclusion, equity, and shared leadership? Where are we seeing change for kids and families? So over the course of every single year, we will be continuously supporting ongoing family engagement and really holding space for families to be a part of that reflection cycle and to understand how we're making an impact and helping provide those meaningful leadership opportunities. We will still be holding strategic plan committees, and we'll be talking about what that's going to look like over the course of the next year to monitor goals and objectives. And then one of the biggest reflection cycles that we hold is through the strategic plan summit. So every single year we'll review stories, data, successes, identifying barriers, and really thinking about continuous quality improvement. It's also an opportunity to ask yourself and your partners hard questions. Did we actually make an impact? For who? Who's benefiting from this improvement? Who's being left behind? How do we actually use what we know about what's working for kids and families to create shifts in policy, funding, and programming? And then in addition to that, we will still have those population level indicators to help track alongside the qualitative insights. So one of the things that we're thinking about is it's not just important to know what changed, but why and how, and then how do we use that information? So before we go into the discussion section of today, I just want to reiterate that I'm so proud of this current iteration of the strategic plan, the engagement, the partnership, the priorities that were set. And I'm even more proud that it does truly feel like Vermont's early childhood strategic plan and not just a BBF document. I'm excited that it's our collective responsibility to make this vision real for the system. So thank you all so much for being a part of that.
Thank you, Morgan. I'm Beth Trzanski. I'm the Deputy Director at Building Bright Futures, and I'm going to help facilitate the rest of our meeting, which we have time for some clarifying questions right now, and then we'll be breaking out into some small groups. So there will be plenty of time for your own reflections and statement, but I want to ask right now if there's any clarifying questions for Nadia or Morgan before we move on. Dimitri, I see your actual hand up. Yes.
I was looking for the digital one. Thanks, but
all right. I see you.
Yeah, so there's a lot in here. I like that it stitches together a lot of the systems, housing, transportation, healthcare. It looks pretty comprehensive. I noticed in infrastructure that broadband infrastructure is mentioned as a bullet, but doesn't have the same prominence that housing and transportation have. And I'm just curious if that was intentional and sort of what the context is there, because it seems today that that's fundamental, especially if we're talking about healthcare access. Broadband may be more important than transportation for some of these things. So just curious what the thinking was.
Thanks, Dimitri. That's such a great question. And I'm going to speak for others, recognizing that I don't know that I have the full answer. But in my mind, as I'm thinking about that section of the strategic plan, it's about connectivity. So if broadband really isn't coming through and other ways of connectivity are not coming through as clear priorities, then I think that that's something that could be strengthened. But I don't believe that it's intentional not to have transportation and connectivity and thinking about all of the different ways that we do that well as prominent areas. Nadia?
I would agree with that. And I think just from our perspective, talking with folks, I think it's really just that housing really was central and elevated to a level of sort of urgent crisis in shaping the daily lives of Vermont families. And so while broadband was named, it was absolutely heard that it was critical, and also just in the level of how much housing sort of rose up when you're thinking about sort of data collection. I think that was it. I don't think there's any I think there's no question about the importance of broadband, and perhaps there is a consideration to elevate it more.
Thanks, Bill. Thanks, Dimitri, for the question. Matthew, I see your hand. Do you have a brief clarifying question?
Yes, I do, and thank you very much. The brief one is, I looked at it very carefully. Where does the investment in values, in here? Where I know there's something missing here. Where do you see that investment in the values of, moving forward with this, because you want to bring back investment of it, but where does the value of it, where will it actually make, they say make or break, but where does it make, the most, not just in my mind, where does it make more, of that, investment in return? Where do those values come? I mean, when we're doing this, I mean, the investment in values, where do you see that play a picture in this role, or a type of role that we're still filling this out moving forward? Thank you.
Thanks, Matthew.
Nadia, do you want to talk about those 6 core values at the beginning that we articulated based on what we heard from the system? And then, Matthew, I think one of the things that I think about related to this work is, and I don't want to say for the first time, but at a really important moment for us as a state and for us as partners in the early childhood system, we are naming the values and naming our priorities in a really strategic way, in a way that I believe is supporting and reflective of what we've heard on behalf of this entire early childhood system. And I think that by naming them and then continuing to come back to them and actually reflecting every single year on whether or not we are living into those values, we are really using them to drive progress for this plan. I also think it comes in the way we measure and monitor, right? So yes, sometimes it will be quantitative, but a lot of the time what we'll be doing is asking partners to talk to us about the impact that we're making in the lives of kids and families. And what I would hope to hear is that as we are making that progress, that we are documenting where we are and are not living into those values on behalf of kids.
Yeah, Morgan, are you asking me to reshare the 6 core values?
Yeah, just so that everybody sees those really, really concretely up front for what.
Yep. So they are, the first of the core values is around families and caregivers being leaders and being central to decision making. And I think you can see that quite a bit throughout in the ways in which there's a desire to uplift the positioning and the roles of families, being seated at tables when there are changes being made. So it's not just sort of aspirational, but it's something that's actually happening. Equity and justice are non-negotiable. Brain and developmental science guide our work. We build on community strengths and resilience. Bold, achievable goals are drive collective action. Accountability, transparency, and continuous improvement are essential. And so, yeah, I mean, without restating all of what we just did, I think when I think about the way in which in goal 1, the values of equity kind of show up in the concrete commitments like paid family leave for workers and housing models that reverse like the historical exclusion, or in goal 2, where we see the values of justice and belonging showing up in the strategies, sort of trying to abolish discriminatory practices and policies and fund BIPOC-led community safety alternatives, all of those pieces that we sort of brought forth. I think those are ways that we see the core values kind of come up. And as Morgan talked about, there are the ways in which we hope to monitor and sort of progress on those values over time.
Thank you. Are there any other clarifying questions while we are together before we break into small groups? Okay. So we're going to move into groups of 3. We've worked to try and pair SAC members together and others in small groups. So I hope that folks are in place to participate. If you're not, we understand. I've just put the reflection questions in the chat. Those are, what are you most excited to steward? So is what part of the plan is, you can get as specific as you want. And then over the coming year, what issues would you like to further discussion together in order to move them forward? And we ask that because we know that there are a range of issues that people feel really deeply about. And we would love to hear folks' reflection when we come back from small groups. And we also know that there are issues that need deeper discussion in the system, things that we may not be in agreement around, or things that we feel particularly stuck and need particular strategy. And so we at Building Bright Futures, we feel really strongly that the State Advisory Council is one of those places to have that level of discussion. We also are frequently having that level of discussion at our strategic plan committees or sometimes at the regional councils. So would love to hear kind of what those issues are that you're feeling to have a cross-sector group be able to come together. So those are the 2 questions. We're going to have 15 minutes in small groups, and then we'll come back together for some sharing and have an opportunity for folks to share. We'll use a 2-minute kind of time limit so that everyone has a chance to speak who wants to be able to share your reflections, whether it's what you're excited about, what you'd like to discuss further, or if you have any other concerns or reflections about the strategic plan that you wanted to share today. So that's our plan for today. So with that, Kate is going to open the small groups and we're going to come back together in 15 minutes. Any questions?
Rooms are open.
Okay, thank you. Turn on your videos. Thanks, Kate. Turning the video or the recording back on. So is there anyone who wants to get us started? Reflections on what you're excited about? What did you talk about in your small groups? Laura, go ahead.
I can get us excited, and then Carol and Laura can jump in if I forget something. I think that the 3 of us were really excited and grateful for goal 1 that recognizes that children cannot thrive without the basic stable housing, food, and income and transportation, et cetera. And removing those barriers is something that kind of, I think we all as a board can recognize that is super important, and it's a unifying goal, but where I think there's very little controversy from all of us, and it's essential. And then each of us talked a little bit about other goals that they're excited on, but that's the one goal that we found unifying. And then I can speak to the other questions unless you want all as one, Beth.
You can continue with your reflections, Flora, all at once if you want. Yeah.
Okay. So as you guys have come to not surprise, goals 3 and 4 is what I'm, the most excited and sort of fully committed to. And I really appreciate knowing that goal 3 is still under construction. I'm not going to hold on those comments, but on goal 4, I really appreciated the thoughtfulness that was put into rewriting some of the sample actions. As most of you know, I spent a lot of time with some of you trying to rewrite some of that. So I really support goal 4 as it powerfully speaks to the early childhood workforce and ensuring equitable pay, professional recognition with the proper licensing and access to high quality and training education. So and the diverse workforce. So I'm grateful for that. And then what I'm committed to, as I was sharing with Carol, was sorry, Lucia. I'm remembering her daughter's name and forgetting her name right now. Sorry. It was that to not have a just as a state advisory council, not just have a one list vote next time, but to continue to come back and reflect on, really clarifying and understanding just the core beliefs like we talked about today and our shared values to really continue that shared stewardship. And I committed to that shared responsibility, but also to understanding there's going to be a lot of going on this year in the transformation of education in the state of Vermont, and we're all going to have to work together through that. And in different ways, it also is interconnected with you, even if you can't see it right now. So that's it.
Thank you, Flor. Others want to, and we'll give SAC members a chance to speak first, and then we'll open it up. Yes, Janet.
Sure. I had we had like a great, really high level conversation with Mike McGrath and Valerie Wood and I, and we mentioned, 3 different things. One was really that focus on basic needs, a real focus on housing specifically, and appreciation for that as foundational. Also mentioned climate, the fact that climate is included, again, this sense of like, we're beginning to think, bigger picture about the role of the early childhood strategic plan and how it intersects with all of the systems. And then that kind of got us into sort of the bigger picture conversation around the fact that this plan really is around sort of like helping us steward our democracy. Like, it's really about public, it's about like, what is the role of community and public servants, and like, how are we working together to achieve, to achieve what we want for our state and for our society. And that they're, in discussing this plan, like it is assuming like right, good governance, and like pushing us towards good governance overall, and like making that a collective responsibility, right? Whether or not it's at a community leadership level, or somebody who's an elected official, or a public, somebody who works in a nonprofit, somebody who works in a in state government. And we just thought, in this exact moment, that's actually a pretty powerful statement that we'd be making together with this plan.
Thank you, Janet. Other reflections? Ray, I see your hand.
Thank you. Yeah, we also had a great conversation, Renee and Courtney and I. And some of the things that I highlighted is kind of continuing on some of the work that we've already begun in human services around removing barriers and coordinating services. So, H91 attempted to kind of the homeless coordination Hearth bill, which got vetoed, but I think it taught us a lot, and kind of hopefully has laid a foundation for us to continue to do some of that work of coordination of services and providing a better coordinated wraparound services for the most vulnerable families, right? Because we know that those families need that support, and that support right now is not coordinated across the state. And that's one thing we learned very obviously in working on that bill last year, is that the housing support services, although they are doing incredible work, it's still not coordinated across the state or consistent for every family that is facing those. And then removing some of the barriers, especially around the denials of eligibility denials. And again, we've begun some of that work with some of the legislative work that we did last year, but really improving systems for families and vulnerable individuals who are needing to navigate the eligibility systems, improving those and simplifying them. And then we also, as a group, talked about really working hard at developing systems to look for efficiencies and coordination as we're heading into a really difficult budgetary year, to work on these goals, but in a way that will help us just achieve better, more efficiencies. And I just also wanted to say that I'm so grateful for this work, and it's sets up such a great model for like statewide model. I wish like we did this at a statewide level, kind of to Janet's point. This is like, these are the things we need to think about for all of our constituents, all of the people that live in our communities. So thank you for everyone who supported this work.
Thank you, Ray. Other reflections? We're happy to hear what you're excited about, what spoke to you, also kind of what you want to talk more about in the future, or if you have other observations or concerns. You don't have to do all three, but
yeah,
those are kind of the three buckets. I see Dimitri's. Yeah, we're going to go to Dimitri and then Eddie. Thanks, Eddie.
Yeah, I'll be quick. I think I may have mentioned this in a previous draft round on this document. There's a lot in here, and I like the fact that it's comprehensive and looks at all the interconnecting systems. Where we'll run into barriers in every one of these areas is likely to be resources. And because there are so many things in here, it's hard to get a sense of how they relate to one another in terms of priority or sequencing, and some consideration to how the resourcing is going to be addressed in order to manage some of these things, because not all of these strategies pay. I believe all of these strategies do pay back in the long run, but not all of them pay back as quickly as we need them to. And we have a lot of systems in crisis right now. So some consideration of sequencing and how do we unlock the resources to make some of these things happen in the right sequence would be helpful.
Great, and I can repeat what Dimitri said. Go back to Ray. Really exciting that how we coordinate on delivering services could be an outcome of this plan, and that's something we should be able to do. A lot of cases, the problem is that these different areas are under-resourced, and we can't just say that, well, we'll resource them. That will be the solution, because we may not have that accessible as a solution. So we need some level of analysis about, okay, what can we do with what we have, as opposed to, yeah, let's put more money into these different areas to pay for these things to solve these problems.
Thank you, Eddie.
I can jump in for our group. We actually started off with thinking about how this plan comes from a point of abundance. And so starting off with the feeling that we can do this because we have the resources. And then to make things happen, and then talking about collaboration, less siloing. And then, the conversation kind of moved into this place of, even if your federal funding or XYZ grant gets cut, how the intentional interconnectedness within this plan forces / allows us, right, to be able to operate in a system where we know who the right people are because of this interconnectedness and this collaboration and these relationships. And I'm just going to end my thoughts by saying, Nadia, where you said co-leaders is really sticking with me. I jotted it down. I was like, oh, that's the word I've been looking for, because that's more than the collaboration.
Thanks, Becca. Deb, go ahead.
I was in a group with Amber and Darla, and we started talking about the document and appreciating how it really focused on, as Becca was saying, sort of eliminating those silos, having better transitions. And from there, we sort of moved into more of a discussion about the workforce issues, and again, how that is sort of highlighted in here. And all of us felt very strongly that that's an important aspect of the being able to make a lot of these things come to fruition. And for me personally, I think the goal 2 is very important with, an investment in preventative health care and access to insurance. And I shared that I had recently been at a talk where the AAP president spoke, and she really highlighted for me that when we talk about Medicaid funding, and I know this from talking to my colleagues, that we're talking about Medicaid funding for individual children and families and the important access for them, but that if practices are losing their funding, that we are going to lose access to healthcare for even those that are insured with private insurances, and that that's really going to impact not just children and families, but beyond to really, the spectrum of our society up into, our elder care, that we really need to have healthy children and families to be able to have the wide breadth of healthy individuals. And so one of the things that that I feel that we can do, and I would like to see myself doing more, is really sharing this document in a way that highlights that it sort of goes beyond prenatal to age 8. I know we have to choose an age group, but I really feel that it goes beyond age 8, into our adult population. And if we don't make the investment now, that's really going to have a devastating long-term impact for our society.
Thank you, Deb. Any other reflections from SAC members before I open it to others?
This is Kiona. I just wanted to, one thing I shared with my group, which I feel like is just a gift of having been able to watch the development of the plan, is how, if you were in that process, you saw how directly and how comprehensively every element of the plan was informed by the stories and the needs and the voices of community members. I just think that that part is not always easy to feel on sort of this side of things when we're doing our best analysis and really looking for tools and strategies. And so the opportunity that I got to sort of do like the headspace, but also the heart space part of the plan development, and just sort of being able to see the words directly from Vermonters about what they need, what they're struggling with, what they know work, and then have them show up in the plan. It's hard to see in any other way other than to have been a part of it. And I'm just really grateful for that, because it builds confidence and it builds like a motivation and a call to action in a way that is really wonderful for the folks who don't get a chance to see that, just to say it into the room.
Thank you, Kiana. That was great to hear. I'll open it to others if you want to share what excites you. What do you feel like it calls for more discussion, or if there is something that is still concerning? So are there others who want to share briefly? Non-SAC members, I guess I should say. Beth?
I will just say that in our group, we had a lot of appreciation for the prevention and early intervention section, and we talked a little bit about that. We had Ellen from the Parent Child Center Network and Andrea from Wild Roots, and so there was a lot of thoughtfulness about how to identify families who might have specific needs, and how the important role of so many of the trusted providers, whether it be the pediatricians, or whether it be the child care providers, whether it be the Parent Child Center Network, how And so I think one reflection that could maybe use more thought is I don't see that we specifically call out the important role of all of these trusted people in the lives of families, and helping, and the work that they do, extensive work that they do to help families navigate and connect to all of these other systems that we mentioned. So I guess I just want to sort of call out that trusted role, the importance of helping to identify families with needs, and how to help. I think it's going to become even more important in the next year or so, helping families navigate all these new rules and connecting them to these really important supports and services. I'm not sure if that's called out in the plan specifically, as I recall it, but I just thought it was important to recognize the role so many people around this table play in helping families make those connections.
Yep. Thanks, Bev. Lee, we'd love to hear from you.
Thank you. I just wanted to say that I am enormously impressed with how the values are articulated and then how they are built into the indicators and strategies. The one gap that I noticed, I have not read every word of this plan, but I have read a fair amount of it, is in the implementation section. There's groups of people and, advocates, legislators, SAC members, etc. And as I looked through that, those sections, I didn't see any mention of the regional councils. And I am a member of my regional council and have been for 30 plus years. And I just hope that I'm wondering if that is an error of omission, or if there's something thoughtful behind not including the regional councils. I'm not sure.
Thank you, Lee. I'm gonna not respond, but trust me, we have not forgotten them. So
excellent.
Great
Thank
question.
you.
Yeah. Other reflections. Becky?
Just wanted to briefly say, like, having, and I know this is true for several of you on this call, like having been a part of the last two of these processes before this one, I can't believe it's been that long, but it has. It's just really exciting to see where we've gotten now. Like, to Lee's point too, like thinking of these in an iterative way, like where we got to with our last one was awesome. And where we've gotten to now is just so much further. And I love how we're into really thinking comprehensively across the whole scope of what affects families and really trying to, and Nadia, credit to you and your team, like, we talk a lot about holding children and families at the center, but we have a lot of trouble figuring out what does that actually mean and how do we operationalize that from a systems perspective. I think that there's always been a real commitment to it, but it's the how has always been sort of stymieing, I think, to many. So I'm so excited to sort of see how, like, where this plan goes and how we collectively look to implement and keep an eye on monitoring. And I just wanted to sort of note, like, thinking about it over time is particularly exciting to see where we are.
Thanks, Becky. It's great to hear. Matthew, I see your hand up.
Yes, thank you very much. I'll go forward. Yes, we discussed about, how can we acknowledge more, resources too for services for with children that have IEPs, to make sure, that we're actually forming. And then another question but for my question was, on there is, on knowing the values, in there, the concerns is, how can we uphold those values and make sure that we're not causing invisible harm? There's that's one question, that never got brought up, is how are we still, in our group, I discussed about, about these systems, how the core values relate to, yes, we can do these core values, but making sure that, the equity and justice, and make sure that, I know we're going on in that, making sure that every value is accounted for. But I said in that regards of, where does, I understand, we're pretty much, promoting, make sure that everybody's involved, but there's some invisible, not just unaccountable, but invisible harm being done because of certain, aspects of it that may not be, they may not know. I mean, there's systems, the Vermont system, as we may know, it's not perfect. Believe me, it's far from perfect. But there are some invisible, to hold ourselves accountable. We got to make sure that we got called out for what it is, and like I said, it's that, if you see something, say something. We have a notion, or our Vermont culture, or our culture has a notion of just keeping our mouths shut when we see something that's very drastic to our community members or our systems that we have in place. But also promote invisible harm because we're not, I understand we're understaffed, but we understand that we're not, we can sit there and say we do our best, but still, how can we be more, how should I say this, a word I'm missing here. How can we be more responsive to those invisible harms once those harms have been done? I mean, everybody gets harmed sooner or later. It's just, how can, this organization understand the values are right there, but how can we prevent further occurring invisible harm from reoccurring in the first place, because like I said, that equity and justice is right there too as well. It also enshrines in that invisible harm too as well. You might not be harming somebody, but you might be if, if it was made in a specific way. Thank you.
Thank you, Matthew. We have time for one last comment if there is one before I wrap it up. Janet.
I'll just offer one more thing that I felt like I was excited from building from what Becky Millard was saying. And I'm really excited about goal 4 around the early childhood workforce being well prepared and well supported. I feel like the specific strategies in here are outlined, are just like, they're just so much further along than where we were 5 years ago. And much more like specific and comprehensive than they have been in the past. And so it feels like the field's learned a lot from sort of workforce development efforts more broadly, like from other fields, other states, national efforts. And so it's exciting to see that included here. And that's a place that I'm excited to see what I could do for my position to support the workforce.
Thanks, Janet. This might be a good transition to talk a little bit about kind of what's next in governance, because goal 4 is new to the plan, right? We heard that the way that the plan had been structured in the past was not really working in terms of how we were tracking progress or even organizing ourselves to be able to implement change. So we're at an incredible place with this plan, and I can't say enough how thankful I am for how much other people care about this plan, and the amount of time that people have put into it is really kind of really impressive, and makes me very appreciative for the community in which we're working together. So moving forward, we wanted today's meeting was to introduce the plan and to be able to connect with each other about how we felt about what was in it, how it was organized, how we got here. So that's today's SAC. We're not calling for any vote on endorsement today. We will call for a vote for endorsement at our October 27th SAC meeting. That meeting is in person. We will be at the Berry Social Club, which is a new venue for us. So if you didn't pencil in travel time, please do that now. We look forward to seeing you. We'll have lunch provided, and we'll collect RSVPs shortly. So what we are doing between now and then is that we are kind of continuing to take any final feedback. We are convening that work session around that goal 3C element around early ed. And so we are trying, we will get to a final document and send it out to the SAC ahead of that October meeting, which means if there is something, we need to hear from you soon. Although I know that we've heard from a lot of people, and we've gotten so much wonderful feedback, and sometimes feedback is in conflict with each other, and so there have been times where we really need to sit and make some decisions about what's the path forward that is articulated in this plan, and how also do we try and come to some language where there is agreement. So that has really been our work. So please give us feedback via email is best in the next week or two, and then we will get a final draft out to folks. Morgan outlined what it means to endorse the plan. This is everyone's plan. We are hoping that everyone will be able to vote on it. And then there's other work that will continue when we move into implementation and to finalizing the plan. We are working with a graphic designer to make it look pretty and to create some graphics that will help us communicate the power of the plan to others. We are also talking about what's the governance structure that is needed to be able to steward the plan well. So we finished, Janet was talking about goal 4. Goal 4 around workforce is new. We don't necessarily, so how do we engage the right partners to be able to monitor that plan? So we really are looking at our current strategic plan structure and what might need to change. That will come. We'd love feedback on that, but we are not necessarily presenting a new governance structure to you today or even next month. That is something that we are continuing to design. So those are just a few of the steps we ultimately, and then we are looking for endorsement. So we'll also kind of launch a process where people can, not endorsement, but where folks can sign on and indicate kind of specific parts of the plan that you're excited about, that your work aligns with, and that you're stewarding moving forward. So those are a few of the kind of key next steps. I want to, again, give so much gratitude to everyone's contributions and time. A special call out to the Strategic Plan Advisory Committee members, which was a subcommittee of the SAC with some additional BBF staff. And that group has been meeting almost monthly for the last year or so. So a huge lift, and has proven to be an incredibly helpful to BBF as we kind of, and to the Creative Discourse Group as we kind of usher this process along, and to have that input. To thank you to the Creative Discourse Group. And thank you to some key BBF staff. I would just want to call out Kate Bailey in particular, who has kind of been holding so many of the details and this process moving through. She's the person in the background that really made sure that things have not dropped, which is not an easy task. So great gratitude to Kate and to the rest of the BBF team who has moved us through that. Other things that are happening in the next couple of weeks is that our regional councils, our regional managers are hosting, yes, thanks Ray and Hannah. So we're hosting a regional council summit. That event is October 16th. That's in person at Capitol Plaza. And that event is free. And if you're not signed up, do it fast because we're almost at capacity. The event is dedicated to addressing the adverse effects of substance misuse on children and families while planting a seed of hope for healthier community. So we have a keynote speaker in the morning who sounds fabulous, followed by a panel in the afternoon. And of course, being together and being able to talk about these issues is kind of the icing to be able to be together. There's a lot more, but I'm going to pause there. Thanks, everyone. And we hope you have a great afternoon.